Welcome to The Explainer. Today, we're talking about something incredibly important, prostate cancer. We're going to break down 10 early warning signs that everyone should be aware of, because when it comes to this disease, knowledge can literally be a lifesaver. Okay, let's just jump right in with a pretty powerful number. The American Cancer Society says that about 1 in every 8 men will be diagnosed with prostate cancer in their lifetime. That makes it the second most common cancer in men, right after skin cancer. A number like that really shows you why this conversation is so important. But here is the single most important message for today. This disease is highly treatable. For men with localized prostate cancer, that means it hasn't spread, the 5-year survival rate is nearly 100%. The key, and I really can't stress this enough, is catching it early. That's why knowing these signs is so vital. So to really understand the signs, we first need a quick rundown of what the prostate is and how cancer can behave when it develops there. So this small gland, tucked just below the bladder, plays a huge part in the male reproductive system. But its location is everything, because as it gets bigger, it can press on the things around it, like the urethra, which is what triggers many of the symptoms we're about to talk about. Now, here's something really interesting. Not all prostate cancers are the same. Some are super slow growing and might not cause any problems for years, maybe even decades. Others, though, are much more aggressive and can spread quickly, which is obviously a more serious threat. This is exactly why regular checkups are so important, even if you feel perfectly healthy. All right, let's get into the core of this explainer. The 10 main warning signs you need to have on your radar. Recognizing these could be that first crucial step toward getting an early diagnosis and treatment. And as we go through these vital signs, if you're finding this information helpful, please take a second to hit like and subscribe. It's a really small thing for you, but it makes a huge difference in helping us share this knowledge with more people who really need to hear it. We're going to start with a few signs related to urination, since they're often the first things people notice. This one is a classic. If you feel any pain, discomfort, or a burning sensation when you go, it could be because an enlarged prostate is blocking the normal flow, which causes irritation. How's your sleep? Are you constantly getting up for trips to the bathroom? This condition is actually called nocturia, and it's more than just an annoyance. It's a very common signal that your prostate might be enlarged and pressing on your bladder, and it's definitely something you should bring up with a doctor. Okay, now this is a sign that you should never, ever ignore. Seeing blood in your urine, which is called hematuria, can sometimes be obvious. Your urine might look pink or red. Other times, it's microscopic and only shows up in a lab test. Either way, it calls for an immediate trip to the doctor. Here's another common one. You might find yourself standing there for a bit before you can actually go, or maybe you notice the stream is really weak or that it stops and starts. Again, this is typically caused by the prostate getting in the way of the urethra. This can show up as small, involuntary leaks of urine, or maybe a sudden, overwhelming urge to go that you just can't control. While it can be a side effect of treatment down the line, it can also be a direct symptom of the cancer itself, affecting how your bladder functions. Pain during ejaculation is a really significant symptom that shouldn't just be dismissed. The feeling can be different for everyone, from a sharp pain to a dull ache, but any persistent discomfort in this area is a clear sign that something needs to get checked out. It's so important to understand that the symptoms aren't just urinary. If you have a persistent, deep, aching pain in your lower back, hips, pelvis, or even your upper thighs, it could be a sign that the cancer has unfortunately spread to the bones. That kind of unexplained pain always needs to be investigated. Because the prostate is located right in front of the rectum, if the gland is enlarged, it can cause a feeling of pressure or even real pain in that area. This can make simple things like sitting for a long time, especially on a hard surface, really uncomfortable. And finally, let's talk about a sign that can affect your whole body: unexplained weight loss. If you're losing a noticeable amount of weight without changing your diet or exercise habits, it's a major red flag. This can happen because advanced cancer cells use up a lot of the body's energy. So now that we know the signs to look out for, it's also really important to understand what factors can increase a person's risk of developing this disease in the first place. And this slide really breaks down the main risk factors. Age is the biggest one. The risk goes up quite a bit after 50. A close family history also plays a big role. And research shows that obesity can increase the risk of more aggressive forms of the disease, while men of African descent have a statistically higher rate of diagnosis. But having risk factors doesn't mean a diagnosis is a sure thing. So let's shift to the empowering part of this explainer, the proactive steps you can actually take to lower your risk and protect your health. These steps are so powerful because they don't just reduce your risk for prostate cancer, they improve your overall health. Eating a balanced diet, staying active, and maintaining a healthy weight are the foundation. And most importantly, have an open conversation with your doctor about your personal risk factors and when you should start screening. We've covered what prostate cancer is, the signs to watch for, the risks, and how you can be proactive. So, what's the single most important takeaway from all of this? This is the key. The goal here isn't to scare you or make you assume the worst. Many of these symptoms can be caused by other, less serious conditions. The point is that these signs are your body's way of telling you to go get checked out. Knowledge is your tool to take action. Thank you so much for watching. If this information was helpful, please share it with the men in your life. It could make a real difference. Liking and subscribing helps our explainer reach more people, and we'd genuinely love to hear your thoughts or experiences in the comments below. We'll leave you with this question. Being proactive and informed is the most powerful thing you can do. The first step for you or loved one starts today.